May I suggest portability? You buy it, it's yours. You leave your job, it's yours. You leave the state, it's yours. I also suggest that you get the tax benefit, not your employer. You go out and buy your insurance and you get the tax advantage. There is a reason why they don't want to do it though. And it's because the biggest clout that the unions have to make their negotiations with large companies is they get these huge medical plans. And the unions say, oh, I'll vote for that guy. But if they lose that power, the power is in us, they no longer have that. How many people here have health savings plans? Okay, I'll make a little explanation for the rest of you. Health saving plans are tax-free, tax-deductible. They earn interest. So if a person starts at age 20, puts in $50 to $100 a month, by the time they get to the age where they really need their insurance, 55, 60, you have $100,000 to $150,000 of tax-free money that's earning compound interest. In the meantime, you can buy a low premium, high deductible for catastrophic incidents and accidents. That's what we need. That's private and free market enterprise. Why don't we let the government clean up the mess that they already have? As I mentioned, $46 trillion in Medicare. The Federal Depository President here in Dallas said that Social Security owes $1 trillion of unfunded debt at present. So let them clean that up. Again, we must have a limitation on lawsuit awards and threats of lawsuits. Most of the physicians that I know are honest people that got into this because they think that this is not only a profession, but a God's calling to take care of our fellow citizens. And we do our best. We aren't perfect. We have laws already for criminals who have gross malfeasance. Let's use the laws we have. Finally, let's adopt free market ideas. Safeway has a great idea. First $1,000, and by the way, they're self-insured. First $1,000 you have in your account. Use it any way you want to. Second $1,000 is up to you. After that, 20% up to $40,000. Whole Foods, I was really surprised. John Mackey, co-founder of Whole Foods, wrote a great article in the Wall Street Journal. He said that we have a self-insured program and we give the first $1,800. And if you don't use it all, it rolls over into the next year earning interest. The second $2,500 is up to you. He says we have stores in Europe, in wonderful England, in France, with their great socialized medicine. And he said, we asked them, what do they want us to do? Do they want us to help them pay in their taxes? They said, no. We want you to give us the money so we can get private health care. Unfortunately, ladies and gentlemen, when we rely on our government, we ignore the natural history of the world. Without honest citizens standing up, what we have is tyrants and despots. Oppressive power not permitted by law or required by justice, absolute unlimited power answerable to no one. Right now, I got these figures out of Investors Business Daily, July 2009. There's 830,000 Canadians waiting to be hospitalized. Dr. Greco says there's more than likely more. But in wonderful England, there's 1.8 million waiting to go into the hospital. We are Americans. We are free people. We're self-ruled through a representative republic. This makes us unique. We were unique with the Mayflower Compact. We were unique in 1776 when we shed our blood, not to overthrow a government, but to establish the rule of law. And we're unique now. We do not need a makeover by any individual. But at last, freedom is not free. The price is that we have to learn the legislative proposals. We have to question our representatives. We have to write to them. And by the way, a physical letter is the best way to get to them. Email is good, but a physical letter will get their attention. And we have to call, and we have to vote. In closing, the miracle of this country's strength is in its liberty, in its freedom, in its innovation, and the power of the individual, not the government.